Hi guys, my name is Ling. I am a med-surg nurse that almost have 3 years experience. Welcome everybody back to my channel. Recently, I just accomplished my 4th travel assignment and that was on the level 1 trauma floor. So I got to see so many traumas and fractures and my assignment. So at this video, let's practice some fracture Nclex-style questions. As always, I wish you guys the best. Good luck at your skeletal-muscular nursing exam. And if you guys are interested in my travel job, click on this video. And alrighty, let's do some practice questions. Question number 1. A nurse is caring for a patient who is 2 days post-op and complaining about severe pain in the right leg calf area. The nurse has already administered 0.5 mg of dilaudid IV. The patient stated there is no relief at all. The nurse assessed the patient's right leg and finds that extremity cool to touch and no pulses. Also, a capillary refill is about 5 seconds. What is the priority action of the nurse? 1. Administer PRN medication. 2. Notify the healthcare provider. 3. Document the clinical findings. 4. Reassess the right leg in an hour. The answer is option 2. Skin cool to touch, no pulse, and capillary refill greater than 3 seconds are indicates that the patient's circulation is impaired. There are several complications that can impede circulations, such as compartment syndromes or deep-vein thrombosis, which require immediately action to prevent damage to the nerve and the tissues and necrosis. Those complications can lead to loss of the leg. The nurse needs to collaborate with the healthcare provider for additionally plan of care. So option 3 is wrong. This option basically is saying the RN is not going to do anything. Option 1 is wrong because the patient is having tissue ischemia pain. This kind of pain is not going to be relieved by muscle relaxer or narcotic pain medication. Option 4 is delay in care and can cause more complications, which can lead to an irreversible outcome for this patient. Okay, next question. Which factor does the nurse consider most likely contributes to the increasing incidence of hip fractures in older adults? 1. Falls. 2. Fragility of bones. 3. Sedentary lifestyle. 4. Rheumatoid disease. The answer is option 2, fragilities of the bones. Bones become more fragile because loss of bone densities associated with the aging process. This often associated with lower circulation levels of estrogens or testosterone. Option 1 says false. False is a characteristic applicable to certain individuals rather than everybody. And my last travel assignment, I did see a lot of older people get admitted to my trauma floor because of falls. However, I could also see they kind of break their bones all over their body. A patient of mine, she fell out from her bathtub. She ended up with a rib cage fracture, a hip fracture, a spine fracture. At first, I seriously could not understand how could a fall could cause so much damage. She told me because she had weaker bones, and that is why when she fell, she broke almost all her bones in her body. And she is not a candidate for certain surgeries because of her weak bone. And nursing students always remember that, especially for females, they have a higher rate of osteoporosis and degenerating joint disease than males. Option 3. Although prolonged lack of weight-bearing activity is associated with bone demineralization, hip fractures also occur in active older adults. Option 4. Rheumatoid disease can affect the skeletal system but do not increase the incidence of hip fractures. Okay, next question. Which of the following symptoms are considered signs of fracture? 1. Tingling, coolness, and loss of pulses. 2. Loss of sensation, redness, and coolness. 3. Coolness, redness, and new sign of pain. 4. Redness, warmth, and pop, and pain at the time of the injury. The answer is option 4. Other options mention coolness, tingling, and loss of pulses are signs of vascular problems. Okay, next question. A patient who had an open reduction and internal fixation of a fractured ankle is being discharged. Which behavior indicates the need for further education about the use of crutches? Select order apply. 1. Immediately after the patient is sitting up from the bed, use a gait belt to raise the patient to fit the crutches. 2. Advancing both of crutches with weaker leg. 3. Leaning aside on the crutches to support the body weight. 4. When sitting with crutches, place both crutches in the dominant hand and use the non-dominant hand to reach back to the chair. Option 5. Moving the crutches before the unaffected leg when descending stairs. The answers are 1, 3, and 4. Option 1 is the right answer. Allow the patient to dangle the leg at the edge of the bed for a minute, assess for vertigo or nauseating, because allow for stabilization of the blood pressure, thus preventing orthostatic hypotension, also increasing the patient's comfort. Option 3 is also a right answer. Bearing weight on the axilla can cause crutch palsy. Weight should be supported by the hands on the crossbar of the crutches. Option 4 is also a right answer. You should use the dominant hand to reach back to the chair. Doing that can increase safety by giving patient an idea how far away it is from the seat. So that being said, the patient should place both crutches in the non-dominant hand. Option 2 and option 5 are right techniques when using crutches. So when I just got started my contracts, there were some new patients got admitted to my trauma floor, and admission question was, which is your dominant hand? My background is more like med-surg, tele nurse, and that was my first time got this kind of strange questions. I was thinking to myself, why does this even matter? And I asked to the staff nurse on the floor. They told me this is for the physical therapy, so they know how to teach those patients to use crutches. Alright, next question. Which principle should the nurse consider when assisting a patient with crutches to learn the 4-point gait? 1. Most of the weight should be supported by axilla. 2. Instruct the patient on the method of holding crutches while the patient remains seated. He should be elbow bending 10 degrees while hands on the hand grips. 3. The patient must be able to bear weight on both legs. 4. The affected extremity should be kept off the ground. The answer is option 3. In the 4-point gait, the patient brings the left crutches forward first, followed by the right foot. Then the right crutches is brought forward, followed by the left foot. So both legs must be able to bear some weight. And option 4 and option 3 are the opposite. We can just eliminate option 4. Option 1 is wrong. In the previous question, we have already discussed that patients should not bear weight on their axillars. Option 2, the patient should be elbow bent 30 degrees instead of 10 degrees while hands are on the hand grips. I know those crutches teaching are kind of too much details and very confusing, but trust me, Nclex, they love to test those detailed questions. And I found a 2-minute YouTube video. It teaches how to walk on crutches by using 2 points, 3 points, and 4 points method. I will leave that in my description box. And remember to check that out. That video is only 2 minutes. It directly gives you the meat and potatoes. Okay, next question. A patient with a fracture of femur has skeletal traction and is encouraged to use an overhead trapeze apparatus. The nurse explained that the primary purpose of overhead trapeze is what? 1. To assist with leg and arm exercises. 2. To enhance breathing and lung expansion. 3. To promote circulation throughout the body. Or 4. To facilitate independent movement while the patient is in bed. The answer is option 4. An overhead trapeze will facilitate independent movement in bed. It also maintains the range of motion of upper extremities and strengthens the biceps. Overhead trapeze is hung on the ceiling and it will not assist with leg exercises. Option 2 says to enhance breathing and lung expansion. The trapeze does help with breathing and lung expansion, but not much. We usually give a patient an incentive thermometer and encourage patients to exercise their lungs. Option 3 says to promote circulation throughout the body. That would be the secondary benefit, not the primary purpose. Okay, next question. A patient is in the emergency department with a suspected left hip fracture. Which clinical manifestations of the left leg would the nurse expect to assess? Select order apply. 1. Left leg muscle spasm and severe pain. 2. Right leg muscle spasm and severe pain. 3. Left leg is longer than the right leg. 4. Left leg is shorter than the right leg. 5. The left leg is abducted. 6. The left leg is abducted. 7. The left leg is externally rotated. 8. The left leg is internally rotated. The answers are 1, 4, 6, and 7. So in a hip fracture, the affected leg is having severe pain and is shorter, abducted, and externally rotated. Okay, next question. A female patient who had hip replacement surgery calls the nurse and reports that she noticed bruises on both sides of her abdomen while taking her bath. The patient's EMA noticed NSAIDs, an antibiotic Q12 schedule, oxycodone Q4-hour PRN, a narcotic analgesic, and Lovana Q12-hour schedule, a low molecular weight heparin. Which is the nurse's best response to this patient? 1. This is a reaction of the antibiotic you are receiving and it will need to be changed. 2. This is caused by stress when trying to have a bowel movement. I will ask the doctor to give you an enema. 3. This occurs because the positioning during the surgical procedure. Or 4. This happens because of the medication used to prevent deep vein thrombosis. I know you can get it right. The answer is number 4. This happens because of this medication used to prevent deep vein thrombosis. The Lovenox is a low molecular weight heparin and is administered in the abdominal area or arms, especially in those fatty areas. Small bruises in those areas suggest a non-life-threatening side effect of this medication's administration. Those bruises will go away in a few weeks. Option 1. Antibiotics might cause a rash on the trunk, but not this phenomenon. Option 2 says straining to have a bowel movement. This will not cause external bruises on the abdomen. Option 3, the patient is not positioning on the abdomen for hip replacement and great care is taken in the operation room to prevent any skin breakdown for this patient. Okay, next question. A nurse is assessing a patient who is experiencing new onset signs and symptoms of paresthesia. What is the most appropriate questions for the nurse to ask the patient? 1. Have you had any changes in your GI habits, like bloating or constipation? 2. Do you feel any difference on your fractured leg, like numbness and tingling? 3. How long have you had fever and chills? 4. The brachial pulse of your good arm and your fractured arm are not the same. Your good arm's pulse is +3, but your fractured arm's pulse is +2. The answer is option 2. Do you feel any difference on your fractured legs, like numbness and tingling? Paresthesia is described as numbness and tingling. My last contract, it was on the trauma floor. We deal with a lot of fractures. And in chartings, we have a big section focusing on paresthesia and vascular documentations like colors, like temperature, like capillary refills, and edema. Paresthesia is not associated with fever or chills as option 3. And it has nothing to do with GI symptoms as option 1 or pulses as option 4. Okay, next question. Which nursing action is or are contraindicated when caring for a patient with a newly applied long leg cast? Select all the apply. 1. Handling the cast with fingertips. 2. Drying the cast by using a fan. 3. Leaving the cast explode to air. 4. Bear weight on new cast for 48 hours. Or 5. Elevating the cast on a pillow. The answer is option 1 and option 4. Handling the cast with fingertip before it's dry may create indentations that can cause pressure. And option 4, not all casts are made for weight bearing. The patient should check with doctors when unsure. Option 2 and option 3 both will increasing airflow that facilitate driving the cast. And option 5, elevating the cast extremity on a pillow will help reduce edema. Okay, next question. Which interventions should the nurse implant for the patient diagnosis with an open fracture of the left ankle? Select all the apply. 1. Apply an immobilizer snugly to prevent edema. 2. Apply an air pad for 10 minutes and remove for 20 minutes. 3. Place a steroid gauze to cover the ankle area to prevent infection. 4. Place the extremity in the depending position to allow drainage. Or 5. Administer tetanus shot 0.0 ml IM in the deltoid. The answers are 2, 3, and 5. Ice pack should be applied 10 minutes on and 20 minutes off. This allows for vasoconstriction and decreased edema. Because this fracture is an open fracture, so there is a very high risk for infection. Nurses can cover the fracture area by using a steroid gauze. And anytime trauma occurs, tetanus shot should be considered, especially in an open fracture. This is an appropriate treatment. An injury extremity should be elevated above the level of the heart to decrease edema, not in a dependent position. An immobilizer should not be applied snugly because it should leave rooms for edema. Okay, next question. A patient is being discharged home with a prescription for cyclobenzaprine. What is the most important information for the nurse to tell the patient? 1. Change your position quickly to avoid dizziness. 2. Avoid activity that require alertness. This medication can cause drowsiness. 3. Allergy medication is appropriate to take if needed. 4. Double a mixed dose to ensure proper drug effect. The answer is option 2. Avoid activities that require alertness. These medications can cause drowsiness. First of all, we need to know what cyclobenzaprine is. It also called Flexeril. It's a muscle relaxer. It can relieve pain-producing muscle spasm and spasticity. A big side effect of this medication is causing drowsiness. So option 2 is the correct answer. Option 1 is wrong because the nurse should teach the patient to change position slowly to avoid dizziness. The patient should not double a mixed dose as option 4 or take over-the-counter allergy medication such as antihistamines. Those medications will potentiate the effect of muscle relaxers. Alright guys, and that is it for part 1 of the fracture Nclex-style question practice. And please like and subscribe my channel. I have a part 2 of the fracture Nclex-style question practice video coming out. I will see you in the next video. Bye.